Well, good morning, everyone. Thank you for joining us. Today's learning session will be on belonging and community, where we will be addressing the roots of disconnection. My name is Veronica Farias. I'm the Director of Network Development with Thriving Together and CW, and I will be facilitating today's conversation. And I'm excited to spend the next 90 minutes learning alongside all of you. Before we begin, I want to acknowledge the incredible work that's happening across our region. Everyday organizations, community leaders, volunteers, and residents are creating opportunities for people to feel connected, valued, and included. And today's session is about lifting up those efforts and exploring how belonging can serve as a foundation for healthier, more thriving communities. Today, we'll explore belonging as a foundational vital condition. We'll look at regional data and community perspectives. We'll get to hear from community leaders doing this work in different ways. And we will engage in a panel discussion and shared reflection. And then we'll wrap up with a few network updates and other opportunities for you all to stay involved. Our hope is that you'll leave with new ideas, new connections, and renewed inspiration for strengthening belonging in your own communities. So before we dive into today's session, I want to briefly ground us in the vital conditions framework. At Thriving Together and CW, we use the vital conditions as a shared framework for understanding what people and communities need, not just to survive, but to truly thrive. The framework identifies 7 interconnected conditions that shape well-being, including things like humane housing, lifelong learning, meaningful work and wealth, belonging, and civic muscle. And rather than focusing on individual programs or outcomes, the framework helps us look upstream and at the community conditions that influence health, opportunity, and the quality of life over time. So at its core, belonging is about feeling connected. It's about feeling valued and included. Civic muscle is our collective ability to work together to solve problems and to shape the future of our communities. We've learned through our work that belonging doesn't stand alone. It influences and is influenced by every other vital condition. So, in other words, belonging is a practical capacity that is needed across all of the 7 vital conditions. So, today we have 4 goals. We'll build a shared understanding of belonging as a foundational vital condition. We'll explore community-led approaches that address isolation and disconnection. We'll highlight examples of relationship-centered and equity-driven work, and we hope to inspire you all as partners to strengthen belonging, trust, and participation in the communities that you serve. So as you listen today, I invite you to think about, where do you see belonging already happening in your community, in your work, and where are there opportunities to strengthen it? So before we get started, or before we hear from our speakers, I'd like to invite our data director, Sarah Bates, to share a few data highlights and insights that help paint a picture of belonging and community across our region. Take it away, Sarah.
Thank you so much. So as we look at the data
No.
surrounding belonging and civic muscle, uh, the IP3 indicators that we use as our framework for measuring how we're doing in belonging and civic muscle, we can see that there are certain indicators where we are doing better than like Washington State as a whole, and there are other indicators where we're doing worse than the state as a whole. And so you can see in this list, these are some of the things that, according to these measures, we're doing a little bit better. So religious adherence, libraries, population change, residential mobility, social associations, public land, and the number of adults in a correctional facility. And I just find it really interesting that libraries, or I guess I should say I'm not surprised that libraries are at the top of the list here. We have such a great library system throughout our region, and this is just a little bit of information from their annual report from last year, that they had over 660,000 people walk through their doors, and a lot of that space for belonging and connection happens in our libraries with their 10 meeting rooms and their ability, greater ability now for teleservice rooms that can be used for a whole bunch of different reasons that can help connect people across our region, which is so large geographically that often it's really difficult to access services. And so that's a huge benefit for our region. Also, I just think that, you know, like, even though we look at these specific data points, no single data point can really tell the whole story. And so I think it's always wise to always be looking for our local data and all the shared data that we can look to. So I want you to think, as you are going through this learning session, about, are these the right indicators for us to be looking at when we're measuring well-being and civic muscle? Are there other indicators that we should be looking at? So keep that in mind, and then send me a quick note when you think of something that we should be measuring. Next slide. So here are the indicators where we're doing worse than the Washington state as a whole. It's around census engagement, residential segregation, which is Black versus whites, volunteering, Black computer and internet access, parks, voting participation, isolated seniors, cultural arts and entertainment institutions, and connected youth in school or working. And I think you'll hear from from almost every one of our speakers today on some of these indicators and the work that they're really doing in order to increase these scores so that we can get closer and closer to our goal of all people thriving, no exceptions. And again, as we look at these nationally collected indicators and measures, I think it's always helpful to then go and look at the local data to get more of this story. So here I brought up the North Central Washington Tech Alliance, and in 2024, they did a digital access plan, and it has a multitude of really great data sources for us to look at. Next slide. So in 2025, we held community dialogues all across North Central Washington, 17 total dialogues with almost 300 community participants. And when we look at all of those comments that were made during those discussions, we see that almost 20% of the comments mention something that, like, within the topic of belonging and civic muscle. So, like, that's a really huge part of the discussion. And interwoven into all of those comments were also mentions of other vital conditions. So how does belonging affect our ability to access healthcare? Are there interpreters and translation services available for access? meaningful work and wealth? How does our feelings of safety and acceptance in a community affect our ability to find a job? Lifelong learning, in terms of like students and our youth, if they don't feel like they belong at school, how is that affecting their learning situation? Thriving natural world, there's lots of access issues if you're disabled, and you might not feel like you belong and that you have the ability to experience the same natural assets that we really have in our community. And then, of course, reliable transportation. If you can't get somewhere, then it's not likely that you feel like you can belong in that space if you have no access through transportation. So all of these vital conditions really work together, but belonging and civic muscle is really at the heart of each and every one of them. So I want to just show you a few quotes from those dialogues that really help to emphasize what people feel like belonging and civic muscle is doing, how it's doing in our region. So next slide. So for instance, one of our Grant County participants talked about her experience of volunteering. So she said, you know, I feel good volunteering. I thought it was impossible because of a language difference. She was Spanish speaking only. I volunteered in schools and I also go to school board meetings. What excites me is that people recognize me as a volunteer and community partner. It makes me feel like I belong. And so that, you know, we look at a measurement of volunteering, and I just think, here's our community emphasizing that point. Another Douglas County participant talked about our library is such a great community center. It used to be tiny. Tonight, there are lots of activities. There's a lot to do, meet with others, and build community ties. And so that just speaks again to the library as a place for belonging. And then in Okanogan County, we heard from a resident who said, I came to this area for the outdoors and stay here for the community. People take the time to talk to others, give of themselves, and help other people. And so these are just some 3 great examples of ways that belonging and civic muscle is growing in our region, and what we want to see for everyone. So I encourage you to check out our data sources on our website. And hopefully, if you see indicators that you think we should be measuring for belonging and civic muscle, please send Veronica or I a message. And I'd love to have that data talk with you about how we can better measure belonging and civic muscle in our area. Thanks.
Thank you, Sarah, for the data insights. All right, so before we hear from today's speakers, we'd love to learn a little bit more about who's in the room with us and who we're sharing space with. We're going to launch a quick participant questionnaire via Zoom with just 3 simple questions. This information helps us better understand who we're reaching, where there may be opportunities for connection, and how we can continue to support the network across the region. So we'll give everyone just a minute to respond, and then we'll move into today's presentations. All right, I still see people filling out the poll. For those of you who aren't sure if you've joined or are a member of the Vital Conditions Network, stay tuned towards the end for some network updates and opportunities for you all to continue to learn and confirm whether or not you're a network member. So we have a lot of folks representing belonging and civic muscle, of course. I love how Okanogan County always shows up to our gatherings. So awesome. Well, thank you. I think we're going to go ahead and end the poll now. And I believe our interpreter has already made it. So just a reminder, we do have interpretation available for anyone who would like to listen in Spanish. To enable interpretation, click the globe icon in your Zoom toolbar and select Spanish. Antes de iniciar más, queremos dejarles saber que contamos con interpretación en español. Para activarla, haga clic en el icono del globo de interpretación en la barra de herramientas de abajo y seleccione el idioma de español. Okay. So, perfect. I think we're good now on our next slide. So our speakers today bring a range of experiences and perspectives, but they share a common belief that strong communities are built through relationships, through connections, and meaningful participation. Through their stories and examples, we'll explore how belonging takes shape in different settings and what it looks like to intentionally create spaces where people feel welcomed, valued, and engaged. So our first speaker is Monte Roulier. As a strategist, coach, and facilitator, Monte has helped hundreds of community partnerships develop change strategies, resulting in healthier people and places. Monte serves on the board of the National Civic Leagues and is the board chair of the Center for Good Food Purchasing. He lives with his family in Boring, Oregon, and is a dad of 6. Monte, thank you for being here. You can go ahead and kick us off.
That sounds good. Thanks, Veronica and Sarah. And so nice to join you in this space today. And yeah, I think as you already heard, there's so much goodness and traction going on in your regional community. And we're going to get to hear some more stories of what that looks like after I share just a couple of ideas. I've been asked maybe just to slightly zoom out, and just to acknowledge that belonging in civic muscle comes down to people feeling connected through genuine relationships. And that civic muscle is really about contribution to a shared purpose. So connection and contribution are linked. The more that we feel connected, the more likely we are to contribute. And the more that we contribute to something bigger than ourselves, the more connected we feel. So there's a little bit of a virtuous relationship between connection and contribution, between belonging and people exercising civic muscle. And one of the things that we've noticed as we've been doing this work around the country, including with you all, is some relational practices that make up belonging. So we don't all have to use the same words, but I'm just going to offer up kind of 3 practices as we get really intentional about how we build relationships of belonging. And on these next 3 slides, are things that we are noticing a lot. If you can hit, one is this idea of connecting with the genuine in others and ourselves. So these are more inner and interpersonal skills that, again, set us up to be able to do collective work. So being fully present to others, to really prioritize consistent social connection, and to reclaim time for self and soul care. So these are different ways that people are feeling like they're able to bring their true selves and be able to connect with others. So more to unpack there, but just want to name that dimension of the relational practice. The second one we've been hearing about in the network here, there's been a lot of bridging work. And so, this ability to bridge across differences that separate us, to be able to hold space for dialogue, sometimes difficult conversations, making space for new perspectives. And we're going to hear a number of those ideas around how we bridge across differences in our speakers coming up, and how we exercise curiosity and cultural humility. So how do we bridge at a time where, there's a lot of othering, where we are in a culture where there's a lot of belonging by othering instead of bridging across differences is a not easily done, but it's happening, and you'll hear more of that. And the third kind of dimension is just recognizing that we all carry some challenges, maybe some wounds. So healing, this dimension of healing and being able to recognize our need for that, acknowledging harms and expressing remorse and extending forgiveness, these things that many of us have been taught since we were young, but aren't always easy to do. How do we restore when there's been harm, and how do we really create emotional space for our own healing journey? So these relational practices and being really intentional about them allow us to build the trust, allow us to build our genuine self so that we can move into exercising civic muscle. So the next slide, I think there's another slide here that one of the groups in Southern California that we're working with, maybe the slide before. Yeah, is just doing all of this, which I think is happening a little bit here in North Central Washington, but they're learning how to build these trust relationships in order for them to take on big changes in their food systems, big changes in digital equity, big changes in economic mobility in places where people who haven't had opportunities, and big changes is opportunities to really protect each other in times where people feel really harmed. And we're going to hear some of that. Again, I think Karen may speak a little bit to that. This next slide, some of you all met Liz in the North Sound. I know Veronica has been up there, but they've really invested in belonging and these relational practices and recognizing that belonging is so central to our well-being, but they're leading with love. That's allowed them to do some really significant work in building their civic muscle around reentry, around some of their new food system work, around really thinking about how they work across systems that haven't always been designed for everyone to work together. So again, I just offer a couple of those threads and hope that you might listen for some of those as we hear from Karen and Donna and Kelly around what you all are up to here locally. So I think Karen's up next to share a little bit about her work.
Yeah, thank you, Monte. So yes, next up we have Karen Francis-McWhite from Four Strands Community Partners. Karen is the founder of Four Strands Community Partners and has over 20 years of experience as an equity and inclusion educator, facilitator, and contractor. Karen works with individuals, organizations, and communities to strengthen their diversity, equity, inclusion, and belonging practices through an equity growth model that emphasizes continuous learning, relationship building, and collective healing. So, Karen, the virtual floor is yours.
Awesome. Thank you so much. And good morning, everyone. It is a pleasure to be here with you today, and an honor, as always, to be working with Thriving Together at North Central Washington. So, yes, my background is in education, law, and community and economic development, which informs my work as a consultant and community learning facilitator. Today, I'm going to present some guiding principles I use in my work with organizations and communities who are seeking to understand how they can create and sustain communities of compassion, care, thriving, and belonging. Next slide. And one more click, sorry. I didn't remove the animation. So this mantra on the left is core to understanding how we got here and how we can do better and be better with each other. Diversity speaks to the reality that the human community is not homogeneous across all aspects of lived experience. Equity is about meeting people where they are and figuring out what they may need to truly access opportunities to thrive and succeed in their lives. Now, this may look like removing barriers, and it may look like addressing the harms created by those barriers. That's where inclusion as a practice comes in, because doing better is humbling work, and we will not always get it right. But the more we commit to a practice of including those who are often excluded, the closer we get to creating communities in which we all feel like we belong. Belonging is an outcome that is earned by the choices we make and our practices of inclusion. Next slide. Now, choosing equitable and inclusive practices operates on both the individual and systemic levels. When we focus exclusively on individual hearts, minds, and actions, but make no changes to how our organizations and institutions function, then we are not creating the conditions for belonging. Similarly, if we only focus on institutional and structural changes, but do not address the individual and interpersonal needs and skills that we need to develop to make those, institutional and structural changes stick, then they won't stick. And the cultural norms will not change. Next slide. So let's look at these two examples. Curb cuts and sidewalks just make sense. If the goal is to ensure that all people, regardless of physical ability, family status, or activity, can access public spaces safely. But they didn't begin appearing in public space in this country until the 1940s, after World War II veterans returned, starting in Michigan, actually, and they had difficulty navigating the city of Kalamazoo. So the city put in some curb cuts. And curb cuts didn't become widespread until the 1970s, after the passionate advocacy and protest of disability rights activists. And it wasn't until the passage of the American Disabilities Act in the 1990s that curb cuts became mandatory. Individual needs drove interpersonal awareness, which compelled institutions to start changing, and then created a new system and new norms about how public spaces should be accessible to all. In contrast, the example on the right illustrates a cautionary tale about how individual biases, empowered by access to greater resources, can create a norm that perpetuates the hate-filled person's biases, even if the people who come after him do not share those biases. So, making belonging structural requires a willingness to examine the norms and practices of our cultures and institutions and organizations, and asking why. Why do we do the things that we do? Who is excluded or harmed when we do those things? And can we find a better way that does less, or better yet, no harm? Next slide. Often, when we talk about understanding the why, the what, the how of the systems that hold our culture together, the conversation can shut down quickly because people are concerned that it's just too political. But here's the thing. Just because a topic is political, because it deals with policies and decisions about resources or access to opportunities and accountability, it doesn't mean that it's partisan. We got to separate those two things. And to help us get to the root causes of exclusion and create the creative possibilities for fostering belonging means that we have to create brave spaces, not just safe spaces. Brave spaces that acknowledge our nervousness about the topics while encouraging transparent, trustworthy co-creation. Next slide. That is hard work. It is hard because we do have to attune our ears, our hearts, our minds, our organizational policies and norms to hear about and learn from the most marginalized among us. Now, the wheel of power and privilege here on the left identifies 12 core facets of social identity, and I think it can be a helpful accountability tool. You see, if the people making a decision that will impact the broader community have identity traits that are concentrated at the center of the wheel, then that decision is likely to preserve and protect practices of exclusion. Regardless of whether the decision makers want to exclude, they're just not engaging with folks who are further away and who have different lived experiences, right? We can undermine our best efforts to be inclusive of all when we make decisions about and for members of our community whose lived experiences and histories we know we don't know. That's the upper yellow there on the here on the right, and whose lived experiences and histories contain wisdom that we don't know we don't know. That's that lower right. Next slide. Next slide, please. Oops. Oh, skip that one. Sorry. Oh, shucksies. Okay, the slide wasn't updated. So, well, I'll tell it. Let's go back to 2 slides. One more. Back again to the wheel. There we go. Perfect. So we're going to use this example. Looking at the wheel of power and privilege through some regional examples. So in 2021, as a result of regional protests that emerged in response to the killings of George Floyd, Breonna Taylor, Ahmaud Arbery, and then the presence of armed counter-protesters at those protests, I was asked and volunteered to facilitate some learning sessions for the Our Valley, Our Future Equity and Inclusion Working Group to help members of that working group, and there are about 40 folks across multiple sectors and across the region, learning across their differences about the history of how we got to that moment, right? And what we could do in our region to help us all heal and build a more inclusive and equitable region together. Since then, I've worked with nonprofits across North Central Washington, and as they were kind of committing to creating their own brave spaces within their boards and staff to explore how they could become more aware of and accountable to the diverse lived experiences of the communities they serve, right? They were trying to move beyond the center of the wheel to be accountable to and responsive to multiple lived experiences. That has led many of them to improve their language access, diversifying their board membership to reflect the communities they serve. They've broadened their staff recruiting strategies so that they're not always sending out their job announcements to the same people in their same inner circle, but they're broadening, right? Building relationships more broadly across the region. And they've often revised their intake and service processes to be more accessible to the diversity of people they work with. But the work of creating brave spaces that foster belonging can also be creative and fun. And so I have to say, since 2021, I've had the pleasure of being part of the Dangerous Women Theater community here in North Central Washington. In 2021, we began in earnest. Oh, thank you, Kelly. With our production Unsettled. We have really made a commitment to not just include Black, Indigenous, and Latina histories and cultures as like window dressing in our shows, right? Our histories and cultures are fully integrated as co-creators of the productions and the organization. And Rona can't be on this call right now, but Rona is the creative director of Dangerous Women. And I credit her humility and her curiosity and her compassion to learn and be open to co-creating with all of us. It's ruined me for working with any other theater community, I'll tell you that. It's been a beautiful thing. So, but let's skip ahead. I know there are other folks coming, and I just want to leave you with one final note So we'll get it. Next slide, next slide. There we go. I want to leave you with this final note on systems change, equity, and belonging um, through relationships. We all have room for growth. Okay? We all have room for growth. Whether I'm designing and facilitating a full curriculum, or running a board retreat, or giving a workshop, or playing a role in a play, I ground my work in this equity growth model because no one is an expert in or has lived experience with all of the facets of social identity that in turn impact how our communities function and whether people have an opportunity to really thrive and feel a sense of belonging, right? So if we are committed to creating a culture of belonging in which all of us have the opportunity to thrive, we also have to create opportunities for us to learn about and from each other about the kinds of systemic barriers that undermine our efforts. We come into that learning with different levels of literacy and different comfort levels, but when we share that common mission and vision that all people and places in North Central Washington will thrive together, no exceptions, then creating those opportunities to learn and grow together are critical to achieving that goal. Thank you.
Thank you so much, Karen. You're so great at what you do, and you offer such valuable education every time I hear you speak. So I greatly appreciate you. So our next speaker is Donna Baillie with Methow at Home, one of our Vital Conditions grant recipients. Donna has been with Methow at Home for the past year and a half, where she has focused on creating programs that bring people together and support aging well in the Methow Valley. Methow at Home's mission is to help people age with dignity and respect while fostering a vibrant, multi-generational community rooted in connection, belonging, and mutual support. Through their work, they're demonstrating how strong relationships and opportunities for contribution can help people remain engaged in the community they love. Please join me in welcoming Donna.
Hi, everyone. Thank you so much, Veronica, and thank you to the whole Thriving Together team for bringing us together today. I always appreciate the opportunity to share about Methow at Home. Um, and I will say I am fairly new to the Methow Valley. I've been here for just over 3 years with my husband, and I love my job because it has really helped me connect with the community and find a sense of belonging and purpose. So I'm really grateful. Next slide. Um, Veronica shared a little bit just about our mission at Methow at Home. We focus on the transitions of aging, and while our main goal is supporting older adults, we really do love to have multi-generational opportunities to connect in the community. I love this photo. It shares one of our members with her cute daughter who joined us on a social bike ride. Next slide. We all know it takes a village, right? And that's really the theme that Methow at Home was built on. A little over 10 years ago, a group of amazing people in our valley we're looking at how most people really want to stay in their homes and remain in their community as long as possible. And they were looking for ways to support that. So they did some research and learned about the Village to Village program, which is a nationwide program that really helps to create it. It created a framework and a way to create a village and use a neighbors helping neighbors format to provide support. So, at our core, at our heart, Methow at Home is a volunteer driven organization. where volunteers support members. Um, but we also try to really expand beyond that to invite the whole community to join us. Next slide. Creating opportunities for connection and belonging is really a key part of what we do. It's a key part of my role with the organization, because we know that it is a critical part of healthy aging. And so we do that in a few different ways. Next slide. I think one of the most valuable things that Methow at Home offers is, you know, great ways to give back and to volunteer in our community. Um, it is something that you just see in our volunteers when you talk to people, like the joy that they feel and the connection that they feel. Monte mentioned that earlier, like contributing really brings connection. So we have volunteers doing a whole host of different things. As you can see, possibly shoveling someone's driveway, providing social visits for people at their homes, installing wall bars for home safety, making birthday calls and just checking in on our members. So there's just a whole host of opportunities. One of my favorite days of the week is Tech Tuesday, where we have a group of volunteers that meet at our local library and provide digital skills support, helping people use their phones and their computers and their uh, devices so that they can stay connected with family and friends, and they can use the online resources that are available, which is so big a part of our modern culture. I love this statistic that we have about 330 active members in our program, and 130 of them also volunteer. So, finding those meaningful ways to give back. Next slide. Social events is kind of an obvious point of connection, but what I've learned is that not everybody considers themselves a social being. Um, and so we really work hard to provide a variety of different events and provide low barrier activities that to make it easy for people to join in. So we host a number of different activities like social picnics or walks. We have sing-alongs, which is a great activity. And we also have garden tours. So just inviting the community, you don't need to be a member to attend and participate, and just putting out those invitations to get people to be together. We have a favorite tagline, bring a friend or make a new one. We hope that people will join us, even if they might not know anyone who's going to be there. It's a great opportunity to meet someone new. Next slide. Uh, I think one of the most beneficial programs we offer are our strength and balance classes. This SAIL program was developed. It's an evidence-based program that was created to prevent falls in older adults. So the focus was on, physical fitness. But we really see this as a true multi-solver. I love that word. And, it is creating an opportunity for people to build connection. You can see this photo. There's so much joy, and that's what you feel when you walk into a SAIL class. Everyone's so happy to see each other. They're supportive and encouraging of each other. The SAIL classes, we have a number of them going on in the Valley, but they meet twice a week. So people get a chance to know each other and support each other outside of class, which is really just such a big benefit of the program. Next slide. Um, I wanted to share a story, and Jean's story is a really common one of grief and loss after losing a spouse. Jean and her husband moved to the valley as adults and enjoyed a wonderful life here. They enjoyed lots of outdoor activities and adventures. And then Jean's husband was diagnosed with a terminal illness. Uh, Jean learned about Methow at home and reached out with her husband for support. And thankfully, our volunteers and the Methow at home community were able to wrap around them to provide that support during the last stages of his life. But of course, his passing left Jean, in terrible grief and feeling isolated. And she made a choice to lean into the connection that she had made with Methow at home and decided that she wanted to give back as a volunteer. I love the quote on the next slide where Jean shares just how much this helped her. She really has a warm heart and has given so much back to our community, and we are very thankful for her. She's a dear soul. Next slide. So, of course, we couldn't do this work alone, and we are so thankful for our partnerships. Um, we have lots of great partnerships here in our local area and in the region, including Thriving Together, which we're so grateful for. And I think that the partnerships really help strengthen all of our work, and it makes our work more joyful to contribute to a common goal. So we are definitely grateful. Next slide. Wanted to share some resources that we use in our work. Commit to Connect is an organization, a nationwide organization that really is doing some great work. They actually have a conference coming up next week, some of you may know of, on social connection. That would be possibly an interesting thing for everyone to check out. And also, I would just share that the Village to Village Network program, which is also nationwide, is a great organization to check out. I often hear from my friends outside of the valley or friends here who have family members outside of the valley. Gosh, I wish there was something like this in my parents' community. And I say, maybe there is. It's definitely something you can look up and see. There are villages like ours or similar all over the country. There are several other villages throughout the state of Washington. So it is a good thing to know about and spread the word and maybe start a spark for another organization somewhere. Next slide. And finally, I just invite anyone who's interested in learning more about Methow at Home to connect with us. We would love to share more about our programs. I would definitely encourage you all to follow us on social media. Thanks to our marketing and communications person, we have some really great content out there. Um, and join our mailing list. We have a monthly newsletter that comes out along with a blog that provides some really helpful information. So we would love for you to connect with us in that way. And I would say even better, if you're in the area, if you're in the Methow Valley, come join us for an event. We would love to see you and get to meet you. So thank you very much for having me today.
Thank you so much, Donna. We greatly appreciate your presentation today and certainly value the partnership that we've created with Methow at Home.
Thank you, Veronica.
All right, so our final speaker of the day is the one and only Kelly Edwards. Kelly currently leads the Okanogan Coalition for Health Improvement, also known as the Okanogan CHI. She brings more than 3 decades of experience in community health and comes from a long line of Eastern Washington leaders and community service advocates. Throughout her career, she has been deeply committed to strengthening communities and creating opportunities for people to connect, to contribute, and thrive. And today she'll offer perspectives on youth voice, identity, leadership, and the important role that they play in fostering a sense of belonging. So thank you, Kelly, for joining us.
Great. Thank you for that, Veronica. And thank you to all the speakers ahead of me. It really is an honor to be in this conversation with all of you. So thank you for the invitation. Next slide. And I especially want to thank the young people. I'm focusing my remarks today on an example that our Okanogan CHI took on over about a 6-month period. We focused on what we called the youth multi-solver. And we had some just remarkable young people who joined us right from the get-go to help us shape this project. And we just really couldn't have gotten it anywhere off the ground without them. So just want to thank the young people who shared their voice and time and experience with us. Next slide. And our whole youth multi-solver team, we came together. This was the group of the people who believed there was something we could do in 6 months that would really make a difference to unhoused young people in our community. These people said yes, and I am grateful to this team. Next slide. Really, for those of you who are wondering what we mean when we say multi-solver, this is how our Okanogan CHI approached the issue. Essentially, we as a team took a look around our communities and said, just where is there momentum right now? And is there a fundamental problem that just keeps coming up, something that is really impacting the foundational conditions of how people are living right now in our community? And does it cut across multiple sectors, or are there multiple issues here that are bundled together? And this one was the crux. It was, does the solution depend just on us, meaning the people around this table in this room, that we hold the solution within us? It's within our power to make the changes that need to happen. So this wasn't the kind of project where, people were dreaming, we needed to go out and write $1 million grant or persuade other organizations to do something different. This was really something that we could control and own and really move the needle on quickly. And it's a pretty empowering approach to solution finding when you recognize just how many solutions are within our sphere of influence. So this was our approach. Next slide, please. And after using that criteria of looking kind of where do we have momentum, what are some really fundamental issues that keep coming up, our group elevated the issue of unhoused youth in our county, because we really saw there was a lot of heart and energy behind young people in our county. A number of youth-focused projects were underway. They just had a real long, anywhere from 1 year to 5-year kind of runway on them. So there was a lot of energy. There just wasn't something kind of immediate yet, with some obvious exceptions, like Only 7 Seconds, who's out there in the schools every day, or Communities in Schools, who's out there in the schools every day, like Fire, who has their after-school mountain program and youth serving services every day. So plenty of everyday activities for young people. But still, we had a lot of youth struggling. And we also could see and hear and experience ourselves that the people that served the young people were struggling. It was really hard to face a situation where, you we've got kids living out of their car in Walmart, and they're coming in for a healthcare visit, and we don't have housing for them. That can just be a real kind of a recipe for struggle and burnout for the people that are providing service. So again, we asked ourselves kind of what could we do that would help create momentum for all the youth-focused projects in our county? And how can we create more access and belonging and connection all around? So we had to start by listening. We convened at Fire, which was a trusted place. It was already seen as a place of belonging for young people in our county. So we convened there. Next slide, please. And some of the stories that the Fire staff and young people gathered were, there was a whole collection of stories and vignettes kind of cutting across sectors, cutting across service areas. You know, these unhoused young people, they were interfacing with all of our agencies. You know, it was the schools, it was the transportation systems, it was the libraries, it was the clinics, the hospitals, social services. Really, that was part of what made this a cross-cutting issue. And the young people told us some stories where they felt they were experiencing barriers to get access to healthcare that really they were eligible for. And when I stepped back and looked at this whole collection of stories, you know, that kids who needed their eyeglasses replaced, had really painful ear infections and couldn't get into to see someone without an adult signature again. Had some painful yeast infections, just some, you know, the clinic not having the birth control that they were there to receive. Almost in just about over 70% of the cases, it was the kind of underlying condition that actually kept the young person from school. And when I listened to the school side of the story, the school staff were essentially complaining about all the absenteeism on the part of the students and feeling like, you know, there were some stories emerging, some narratives around, you know, young people just they don't care about school, they're not showing up. And I could hear all these stories about what was going on for the young people, just some underlying painful conditions that were keeping them out of school for the day or the week. So really we had a challenge on our hands. And when we debated as a group with the young people at the table with us, kind of what kind of solutions should we take on? And they said, can you please just be accountable to the laws and policies that already exist that allow us to access healthcare without parental or guardian signatures. What can we do about that? And so thankfully, we had an incredible champion, Dr. Brendan Smith, within the Family Health Centers. He really took this to heart, got some extra training in youth-centered practices, brought it to his staff, and just regrounded everyone in youth-centered practices and what the laws are when it comes to access to health, eligibility of access to healthcare. Next slide, please. And there's a lot more to say on the side of the story that Dr. Smith really worked with his clinics on, and he'd be happy to share some of his trainings with any system here. But really what the young people, you know, they were just really trying their best, but they're hitting these systems that are not built for young people. You know, and just running, when you're hitting barrier after barrier after barrier, you know, it takes a lot for any of us to ask for help. And when you've just hit one barrier after another, you can just really end up, you know, just kind of giving up on these systems. And in many of the systems case, yeah, as Karen's presentation just really illustrated beautifully, they might have been built from one perspective. A lot of our consent laws are built to protect people's, self-determination, but they also can inadvertently cause harm and create barrier when we're not thinking about unique contexts that people are living in. So next slide, please. And this is just a quick PSA that it is complicated to know all the range of rules and laws around minors accessing healthcare, but there's some great resources out there that just give you a simple guide. And we're really lucky with a lot of our block grants and Title X resources that allow minors to access mental health, reproductive health care, all for free without needing to charge an insurance company. Next slide, please. And just quickly, this version of an iceberg was just illustrated, what the young people could really feel, kind of the eyes of judgment on them. They felt like they were being seen as troublemakers. And especially for the Black and brown kids in our community, one of their just devastating quotes was, kids that look like us were not even given first chances, never mind second chances. When really kind of underneath the surface, they are just navigating so much just to get by on a day-to-day basis. Next slide. And so back to the providers, we could see, that it was really difficult for the providers to not be able to solve all the problems that a young person was presenting with. And the providers can get taken over by this feeling of hopelessness or helplessness. And it can present as burnout, where you're just really kind of shut down towards the kids that are coming to you. And if you've been in the field for a while, some of those kids were getting written off as not worth time or care, which is just, it's heartbreaking, and it happens to frontlines workers. And so what could we do on the front lines? And this is where that hearts and minds part of it comes back into play, is knowing that just your presence matters. We really, there were laws we needed to abide by, but really it came down to like, take a beat and really listen to what the young person is really asking for today. How can you support them in getting access to that thing that they need help with? Ask, get curious. I think Karen mentioned curiosity. Like, how can we get curious if they have got someone in their corner? And really using warm hand. These systems are really hard to navigate. As an adult with advanced degrees, they're hard to navigate. So really using those warm handoffs and making sure that we're following through to make that the kids are getting where they need to go is really useful. Next slide. And so when we listened to what the young people need, they were like, we know there's no housing, Fire is working on a youth shelter right now in Okanogan County, which will be amazing. The juvenile system is also working on a 5-bed diversion center, which is going to be amazing. But they know we don't have housing. But so they really wanted to just be true, that idea of I see you, really be seen and met with respect. Wanted to be able to take a shower or to charge their phone or know that they had a trusted adult in their corner. And this one was also really important. They wanted to be able to have hopes and dreams. One other quote from one of the young people was, I want to be seen for my potential and not my traumas. And when I was able to share that concept with some of our school nurses, it really kind of was eye-opening as far as thinking, a lot of us do case conferencing with the filter of like thinking about what traumas a person has experienced so that we can know what kind of care coordination we might be able to do. But now how have we lost the sense of that young person's just self-effect, the resilience that have gotten them to where they are now, and what their dreams are for the future. So next slide, please. And I'll move a little more quickly here. So we in this collaboration between our youth advisors and the clinics, we came up with a few phrases that would just really make a big difference. So instead of saying, I need your parent's signature on this form, instead of that, saying, would it be a problem for a parent to help you fill these forms out? Kind of leaving the door open for some other kinds of solutions. Just naming that I'm sorry, I'm frustrated with the lack of resources. I'm not mad at you. This was another important story. Your privacy is important to me. Is there anything I can do to help right now? The whole of Okanogan County is a small town, really. And when you've just worked up the courage to get into the clinic and you've figured out your transportation to finally get to the clinic, and now you're in the waiting room for some time. If your mom's best friend walks in or your neighbor walks in, and it can feel very exposing to sit there in the waiting room. So one thing we worked out was, could there be, just having the front desk folks ask, is there anything I can do to help you feel a little, just more comfortable as you wait? It's going to be about a half hour. Move them into the back room, perhaps. And just to name, you've done nothing wrong. It's our system is not set up for this if we're having trouble navigating. Next slide, please. And just finally, it might be surprising when we were kind of surprised when the young people were like, yeah, we really want to work on access to healthcare. We were like, okay. And it really brought us full circle, though. It was absolutely about upholding the laws and being accountable to the laws that are there and retraining staff on all that. And that's kind of like yes, we can do that. But it really, at the heart of the intervention and the part that could cut across all of our systems, it had to do with belonging. It was a reminder for all of us that we all have a role to play in creating greater safety and belonging. And really getting curious about these young people and what choice and voice that they have in helping us shape the system so that they can really be places that center young people and others who need to access their services. And again, just finally focusing on the opportunities and the possibilities that are there, and not just on the crisis and the trauma. And I think that might be it for me. Oh, yes. And wanted to close out with this beautiful phrase from one of our youth advisors, and she's Paulina Naranjo is a nursing student. She's in nursing school right now. She was also a fire staff member, but she really, in her summary of our work together, said, healthcare is not just treatment. It's dignity, safety, and survival. And for unhoused youth, access to care can mean the difference between crisis and stability. So again, we all have a role to play, and I'm grateful to be in this community with all of you in the work.
Mm.
Thank you, Kelly. Thank you for all of those thoughtful presentations. We've heard examples that span systems change, aging in community, youth voice, leadership, equity, relationships, and community connection. What stands out to me is that while the approaches may be different, there is a common thread across the board here, that belonging doesn't happen by accident. It is intentionally created through relationships, through trust, through participation and shared responsibility. So I'd like to invite Monte back to help us weave together some of the ongoing themes and
Yeah.
facilitate our Q&A portion of our time together.
Yeah. And thank you, Veronica. I think you did a nice job just weaving right there of kind of the beautiful, presentations and wisdom. Since we don't have a lot of time, I might just ask a similar question to all three to kind of circle back. Kelly, you started with what's in our power? I think with those that are listening, like what's in our power? What might we do next? And so just want to ask each of you, Karen, you talked about, these systems were not designed for everybody to thrive, that it takes both brave and safe space. The question is, where might we start? What would you recommend as either starting point and or what's giving you hope? So I'm going to ask you a version of that for each of the speakers. So Karen, are you still there?
Monte, looks like Karen had to jump off, so we might
Okay.
want to pitch that either to Donna or Kelly.
Well, great. Well, Donna, some variation. You've identified social isolation and the work that you're doing is so inspiring. You gave us some examples. But what do we need to know as we step into really caring for our elders and the synergy between volunteerism and serving them and being served by them?
Yeah, yeah. Well, I think one thing we learned a few years ago when the Surgeon General's report came out about social connection, the big narrative there was that poor social connection and social isolation can really significantly impact our long-term health. So at Methow at Home, we really take that seriously. And so we're very committed to providing these opportunities to bring people together. Um, but as Karen shared earlier, like belonging, it really takes effort and it takes making a choice. And we really need to share that message that, we've all learned that eating healthy is important, that exercising is important. And we're really trying to share that message that social connection is just as important. And trying to reach people in ways that feel valuable and, like an interest to them. So that's really the big message that we just need to continue to share with our community and our members. Um, that it's important to find some way that you can connect with others and have that sense of belonging.
Yeah. Yeah, thank you for that, Donna. And as some of you know, that Vivek Murthy, the former Surgeon General that you reference, helped us launch the vital conditions. And one of the reasons why belonging to civic muscle is at the center of that is because of Vivek and recognizing how important social connection and belonging is. And as you said, how do we make that really intentional, that work that we do, because it is so central to what humanizes us. Those of you who haven't read his final prescription, which is all about community, it's worth a read because he makes the case this isn't just a public health crisis. This is what keeps us from being fully human. So love that you've built on that. And yeah, Kelly, I mean, there's so many ways that, you all are thinking about multi-solving. And I guess the way I'm hearing it is you could have taken a more siloed approach, a more traditional social service agencies alone, and yet you took a more holistic approach, which is really what the Vital Conditions is about. So what is it that you're learning about that is really the key to multi-solving or that you'd like to double click on?
Yeah, and so I think both similar to Donna, youth at the other end of the spectrum of that similar crisis of isolation. And so I think with us, as we got into just the work of multi-solving, it was because you are looking across sector. Our group would start to go out to wanting to solve kind of all the world's problems for all the young people in our county. And we just had to keep kind of refocusing again and again, so it's a little dance when you're dealing with complex interdependent systems, when you're saying, it's the yes, and we are looking at a complex interdependent system. And we need to focus, in this case, kind of refocus ourselves on youth who are experiencing housing instability and who are unhoused in our, because if we could move the needle and improve situations and our systems for that group of young people, we're going to improve them for all young people. But really kind of keeping our sights focused, and so that we'd have something real actionable to work on in this time, and keeping it time limited was also really important for us. But really that the takeaway of we all had an opportunity to do a self audit on what can I do just in my day-to-day work and life, and moving about community, that one, not underestimating the power of eye contact when someone walks in the door, to what does it mean to truly see and truly welcome another. That's just an ongoing invitation that we all took away.
Hmm. Yeah, that's beautiful, Kelly. And your example of just even the providers that feel a little bit stymied and stuck, and to say, oh, there's a pathway for me. And it begins with relationships. So I can't maybe take on the whole system, was really inspiring to me, what you shared. And I think if Karen were here, one of the things I took away with her Brave Space piece is one of the things that is doing is we're seeing each other's capabilities as co-creators, right? We're bringing in voices in some cases that are marginalized, that we've excluded. And that sometimes is our seniors, and that growth opportunity to say, wow, our young people actually are going to tell us the way forward with some of this work. Our elders have a lot to still give us in these opportunities. And so that we all have opportunities to grow, to say, how do we continue to bring others in so that we're growing together? Curious if I'm looking to see if there's other folks that want to comment on this, and I want to just pivot for a minute because Veronica may have something to share, because I think the network's really investing in belonging to civic muscle with some of the grantees. So I'm looking for the chat if you want to put anything in there. Maybe in the meantime, Veronica, do you want to talk a little bit around how belonging in civic muscle is getting invested in by the network?
Yeah, so as some of you know, we launched the Vital Conditions grant last year and are in the current project year with those investments. When I introduced Donna and Methow at Home, I highlighted that they are one of our grant recipients, and I know some others were on the call, Thrive Chelan Valley, I believe, Cafe. So one thing we've seen through the Vital Conditions grant is that belonging shows up across nearly all of the funded projects, even if it isn't the stated focus of the proposal to begin with. So whether the work is focused on youth engagement, environmental stewardship, community programs, we consistently see that relationships and connection are a part of what makes the work effective. So, yeah, partners are, creating spaces where community members feel heard, where trust is being built over time, and where participants aren't just receiving services, like you mentioned earlier, but are actively contributing to what's shaping the communities and what's happening out there. So, certainly co-creating with the communities that they serve. Um, and yeah, I'm curious if there's others that are either seeing belonging show up in their work, if it's not, their organization's primary goal. So maybe we'll open it up for a couple of minutes and then we can wrap up with some network updates.
Yeah. I know some folks had to leave, but that's a good, yeah, other ways that you're seeing belonging, or something that you just heard, over the last hour that really inspires you or gives you hope. Feel free to come off mute if you'd like, or something in the chat if you'd like.
Looks like Melissa shared something in the chat. Belonging is, of course, central to our work at only 7 seconds. The level youth are leading. This effort is inspiring.
Hmm.
A few shout outs.
Yeah, and 7 seconds is such an extraordinary local asset that's having national, maybe global impact. So excited that they're part of this effort.
This is Casey. I'm a bilingual client advocate here at Room One, and just let's see if I can turn the camera on. Can you all hear me? Okay.
Mm-hmm.
Yes.
There's a lot of very inspiring. So there's a lot of thoughts and questions swirling. So I think mostly would just say thank you so much for hosting this conversation. I've been working with some community members in really just trying to create spaces for relationships to be formed, because the systems and direct services that we provide are, while super effective and important, just aren't enough. And we have all different sides of our community looking for ways to connect and get to know people, genuinely, and build those relationships. So most importantly, just want to say thank you. And this is all very affirming and inspiring.
Thank you, Casey, and thanks for sharing. I do think it's really interesting to watch communities. Things become contagious, social isolation, othering, people kind of retreating, and people starting to turn towards each other. So it feels like just all the assets in this region, we're seeing some real hopeful signs of groups turning towards each other, really intentionally around building belonging, starting to exercise civic muscle. And I know many of us that look at these things around the country are saying, look at this large regional community and some of the things that are starting to take shape here. So I'll just say from an outside perspective that's been an ally, I'm really inspired by what's happening here.
I do also actually just want to chime in again, if it's okay to sort of pass along kudos to all of you on that note, Monte, because I've had a number of people, Thriving Together has put together so many amazing workshops and trainings and opportunities to connect regionally. And I was talking to a couple of people in very different times saying like, hey, I got to go to this workshop or this gathering. And as people who are not working necessarily in community or service positions, we're like, I've really been seeing this big move where like people are collaborating and like, cross-sectional solutions, stuff like that. It's really cool to see people outside of this field noticing that and just hear them saying like, wow, that really gives me hope. So really cool when people outside of this work are seeing everything that's being done.
Oh, thank you so much for voicing it.
Just going to mention that I was really inspired by our speakers today, especially Donna and Kelly, talking about how even though their focus might be our older residents or our youth, there really is a lot of connections between different groups. And so to see these groups coming together, right, that Donna has the children and grandchildren of her main members joining in on the social, and how that dynamic changes our sense of community and belonging when it is multi-generational. And I know in the early discussions with Kelly and the youth was talking about mentorship and having that one trusted adult in their lives and how important that is. And so I can just see so many connections that can happen across our region in the work that's being done.
Veronica. Yeah, sorry, go ahead.
Yeah, no, thank you all for the amazing reflections and certainly contributions in the chat too. I've been having, it's been great just reading some of these. So I know we're reaching time here, so I'll try to quickly wrap up and go through some network updates. We have nominations for our annual awards are open through July 31st. I think we'll be adding some of these links in the chat as I'm sharing these, so feel free to snag them from the chat. So if you haven't already, please nominate individuals making a difference in our region and consider joining the evaluation committee. Also, please complete our mid-year network survey so we can better understand your needs and shape future learning opportunities. And then join us back here, same time, for our learning session on August 20th. It will be focused on lifelong learning and belonging, and we'll also be featuring some Vital Conditions grant recipients. And last but not least, please save the date for our third annual Thriving Together Summit on October 21st. We will be hosting it at Big Bend Community College here in Moses Lake. So if you happen to have another 2-3 minutes before we leave, we greatly appreciate your feedback on today's session. I think we're going to launch just a quick survey It's just three simple questions, and your responses will certainly help us better improve the different learning opportunities that we offer our network partners moving forward. So if you have a few minutes, feel free to complete the survey, and then thank you so much in advance for sharing your thoughts.
Thanks, Veronica, for hosting, and Monte and Donna and Sarah, thanks for contributions. Casey, thanks for chiming in.
Yeah, thank you so
Yes.
much to our speakers for sharing their experiences, wisdom, and examples. And thank you all for being here, for the work you do every day, and your commitment in creating communities where everyone can belong. So
Yeah.
Thank you so much, Veronica and team.
you're welcome. Thank you all. And thank you to those that are filling out the survey. We greatly appreciate it. All right. Looks like we still have some people filling out the survey, so I'll let it stand for a couple more minutes maybe.